morning, this is All India Radio Kohima. The morning news read by Nobin Pradhan. Despite the enforcement of the total lockdown in the state, Nagaland's surging second wave showed no signs of abatement, with another 241 persons testing positive yesterday for the infection, surpassing the tally to 18,000 mark, while 13 more succumbing to the disease also resulted the COVID death toll in the state to 198. Health Minister S. Pangnyuphom tweeted that Kohima has 103 new cases, Dimapur 102, Mokokchung 14, Longlang 10, Zunheboto 5, Phek 3 and 1 each from Mon, Kipire, Twensang and Peren. Among the new cases reported, 125 cases were detected from self-test or random test, 104 from the traced contacts, 9 from the returnees, 2 from the armed forces or security personnel and 1 frontline worker. On the other hand, recoveries of 108 positive patients from the disease have added the tally of recovered cases to 13,195. These include 58 from Dimapur, Kohima 36, Mon 6, Longlang 4, Phek 3 and 1 in Mokokchung. Of the total 18,076 confirmed positive cases in the state, the number of active cases has now mounted to 4,100. Revealing that Dimapur district alone accounts for 61% of COVID positive cases in Nagaland, Nodal Officer Dimapur for COVID-related activities Y. Kikheto Sema observed that the state needs to prepare for the worst. Speaking to DIPR, Sema expressed the urgent need for beds and oxygen as both government and private hospitals have run out of the available facilities. In this regard, Nodal Officer Dimapur for COVID Y. Kikheto Sema along with Commissioner Police Dimapur Rothihu Tetsio yesterday visited Olive Hospital Dimapur and met with the director of the hospital. While lauding the hospital management for attending all non-COVID patients, Kikheto requested the director to start a makeshift camp at the backyard of the hospital with at least 30 beds to be activated by next week. For this, he directed the district administration to request the Indian Army for setting up the makeshift camp at Olive Hospital, similar to that at Eden Hospital. The team also visited Nikos Hospital. The first pressure swing adsorption oxygen generation plant in Nagaland will become functional today at Naga Hospital Authority Kohima. Health Minister S. Pangnyuphom will inaugurate the PSA plant. Donor Minister Dr. Jitendra Singh also tweeted that Nagaland's first stress swing adsorption PSA oxygen generation plant funded through PM CARES fund at Kohima will be functional by today. It may be mentioned that construction of the other 2 PSA plants, one each in Dimapur and Mokokchung district, is progressing. Considering the requirement of remdesivir in every state and ensuring its adequate availability, Union Minister of Chemicals and Fertilizers D.V. Sadananda Gowda yesterday announced the allocation of remdesivir made up to 23rd of May. He said substantial increase has been made in overall production and allocation of remdesivir. Meanwhile, in the state-wise allocation for the period of 21st April to 23rd May, the centre has allotted 5,000 remdesivir to Nagaland. International Invincible Gold Medal of this year has been conferred on Union Education Minister Dr. Ramesh Pokhriyal Nishank. Maharshi Organization's worldwide president Dr. Tony Nadar said Dr. Nishank has been recognized for his extraordinary commitment and outstanding service to humanity through his writings, social and illustrious public life. The decision was made after due deliberations by a high-powered committee duly constituted under the leadership of Dr. Tony Nadar. The honor was announced at a 2-day virtual session which was attended by representatives from over 110 countries. The award will be formally presented to the Union Minister on Guru Purnima this year. And as the number of COVID cases are on the rise, we appeal to our listeners not to lower the guard, follow all the precautions, and all those above 44 years who have taken the first dose of COVID-19 vaccine to get vaccinated with the second dose at the scheduled time. Stay safe and protected by following these 3 simple steps. Wear a face mask, focus on hand and face hygiene, and maintain a distance of 2 yards for social distancing. And that's all the news we have for you this morning. Have a nice day.